Welcome to the deep dive. Early pregnancy. It's such a time of immense hope, isn't it? But also often shadowed by quite a bit of vulnerability.
That's right.
So today we're really doing a deep dive into how specific, consistent supportive measures might, genuinely help stabilize those earliest, most critical weeks.
Exactly. We've looked at a fair bit of research focusing on one particular supportive approach, acupuncture, specifically its role in potentially maintaining early gestation and maybe reducing the risk of loss.
Especially for certain groups, right?
Yes, particularly in what we'd call high-risk groups.
Okay. So our mission today is pretty focused. We want to distill that research for you, clarify the really critical time frame when the risk is actually highest, and then break down the specific biological mechanisms that acupuncture is, well, thought to address.
And importantly, we're going to zero in on a specific protocol that comes up in the evidence, this twice-weekly 13-week approach. We'll explore why that specific duration seems to be key.
Right. So context first. Miscarriage. It's more common than many people realize.
It really is. Medically, it's defined as a pregnancy loss before the 20th week. And the statistics are quite stark. It affects up to, well, maybe even 20% of known pregnancies.
20%, that's a huge number. It really highlights just how many people are navigating that sort of tightrope of excitement and anxiety, especially in the first trimester.
It absolutely does. And it underscores the need for effective support.
So if we look closer at that timeline, where does that risk really concentrate? You mentioned the first trimester.
Yes, if you zoom in, the picture becomes really clear. The risk is heavily, heavily front-loaded. The vast majority of these losses, we're talking around 90% according to the sources.
90%?
Yes, 90% happen by or even before the 12th week of gestation. So that 12-week window, that's the highest risk period of the entire pregnancy by far.
Okay, so why? Why is that period biologically so volatile? What's actually happening then that makes those first 3 months so incredibly sensitive?
Well, think of it like building the absolute foundations for a house, but on a microscopic and incredibly rapid scale.
Okay.
The embryo is doing two massive jobs at once. First, it's trying to establish a really secure physical connection that's implantation. And second, it's developing all its core systems at lightning speed.
So any little wobble can have big consequences.
Precisely. Even small imbalances can get magnified. The underlying challenges that researchers and practitioners are often targeting include things like hormonal instability.
Like progesterone?
Exactly, maintaining those crucial progesterone and estrogen levels. Also, potentially inadequate blood flow to the brand new structures being formed.
Right.
And of course, stress. Unchecked stress can really disrupt that whole delicate hormonal balance.
So the goal for any kind of support then is essentially to shore up that foundation, make it stable, and help the pregnancy get past that critical 12th week mark.
That's the statistical goal, yes. Because once you get past week 12, the risks historically just plummet.
They drop off a cliff, as they say.
Pretty much. The bodies generally confirm the embryo is viable by then, and the major life support systems, like the early placenta, are getting established. You enter a much, much safer zone.
Okay, that makes sense. So let's get into the how then. If the instability is linked to blood flow, hormones, stress, how is acupuncture thought to actually, tap into those physiological processes during these early weeks?
Yeah, this is where it gets really interesting, seeing how traditional mechanisms align with modern understanding. The sources detail three main interconnected areas where acupuncture is proposed to intervene.
Okay, what's the first?
The first, and maybe the most critical one biologically, is promoting robust blood flow.
Blood flow specifically where, though?
Extremely targeted. We're talking about promoting circulation directly to the yolk sac, that's the baby's first little nutrient pack,
Right.
then to the developing placenta, which is the crucial future lifeline, and very importantly, to the uterine lining, the endometrium itself.
So it's like ensuring the embryo's new home has the best possible plumbing and delivery system.
That's a great analogy. Good plumbing for nutrients and oxygen. Good circulation is just fundamental for stable implantation and growth. It's non-negotiable, really.
And is that effect immediate, or does it build up over time with treatment? Because you mentioned that specific protocol later.
That's a key point. The research suggests it's accumulative. A single session might help someone feel less stressed, sure. But the deeper circulatory and hormonal support seems to require sustained input.
Right.
Which is why the protocols that show success involve multiple sessions over quite a few weeks. It's not really about a quick fix. It's about building that physiological support structure over that critical time.
Okay, so blood flow is number one. What are the other two areas?
Second is hormone regulation. Acupuncture has, well, a documented history and practice and some growing research suggesting it can support the body's own hormone regulation. Early pregnancy absolutely depends on maintaining very specific high levels of hormones like progesterone.
Mm.
So the idea is that treatment encourages the body's own systems to kind of maintain that balance.
And the third, you mentioned stress earlier.
Yes, third, and this is maybe the most relatable for many people, is easing stress and anxiety. We know stress triggers cortisol, right?
Right.
And high sustained cortisol levels can absolutely throw off hormonal balance and even constrict blood flow, basically working directly against the stability we need. So reducing that chronic stress isn't just about feeling better. It's seen as a direct physiological intervention here.
Okay, so putting it all together, you've got potentially better, more localized blood flow, steadier hormonal signals, and less disruption from stress hormones like cortisol. It sounds like a pretty comprehensive biological strategy.
Exactly. Aimed squarely at protecting that developing embryo during its most vulnerable stage.
Yeah.
These aren't really isolated effects. They seem to work together, creating a kind of synergistic loop that supports implantation and helps manage that tricky transition phase before the placenta fully takes over.
Makes sense. Now let's pivot from the how the mechanism to the what happened, the outcomes. Which patient groups does the research seem strongest for? Is this something potentially for everyone, or is the data really more compelling for those already identified as high risk?
The most compelling evidence, consistently, seems to emerge from studies looking at patients who were already defined as high risk,
Okay.
specifically individuals with a history of recurrent miscarriage. And that's typically defined medically as having 2 or more previous losses. That population shows up repeatedly as potentially benefiting.
Right. Can you break down some of those findings?
Sure. So one systematic review looked at various Chinese medicine approaches, including acupuncture, and found really promising results for preventing what's called threatened miscarriage.
So that's when someone is actually having symptoms.
Exactly. Patients experiencing active symptoms like bleeding or cramping. The review noted that these approaches were associated with reduced symptoms and generally better outcomes compared to just standard care alone.
Just reducing their scary symptoms must be incredibly valuable psychologically, even beyond the final outcome.
Oh, absolutely. During such a period of fear and uncertainty, symptom relief is huge. And then beyond just symptom management, another big review focused specifically on recurrent pregnancy loss.
Mm-hmm.
It noted that integrating acupuncture, often alongside Chinese herbal medicine in these studies, was associated with improved live birth rates. These are complex cases, so that's significant.
And what about implantation failure? That's a huge hurdle for many, especially with IVF.
Yes, that's another key area.
Yeah.
For those struggling specifically with recurrent implantation failure where embryos just repeatedly don't seem to take hold properly,
Right.
a separate meta-analysis, this one looking only at randomized controlled trials, showed acupuncture improved the clinical pregnancy rates. And, importantly, it also seemed to reduce the subsequent miscarriage rates after pregnancy was established.
How? What's the thinking there?
Well, the hypothesis often points towards enhancing what's called uterine receptivity, basically making the uterus physically a more welcoming, supportive environment for the embryo to implant and thrive. Better plumbing, again.
That evidence for high-risk groups, recurrent loss, implantation issues, it really is compelling. Let's zoom in on one specific group where the metrics are often very clear. Patients undergoing IVF. You mentioned a data point there that was quite striking.
Yes, that study provides a very sort of clean comparison. It looked at IVF patients and those who had acupuncture support as part of their cycle. Well, they essentially halved their miscarriage rate compared to the control group who didn't have acupuncture.
Halved. What were the numbers?
The loss rate was reported as 5% in the acupuncture group versus 11% in the control group.
Wow. 5% versus 11%. Having the risk in a population that's already under such intense medical monitoring, that feels statistically powerful.
It's a significant finding, yes. It really does shift the conversation, at least in that context, from just a potential supportive measure to something showing quantifiable risk reduction.
Definitely solidifies the potential impact. Okay, let's talk practicalities then. If the support is most needed before that week 12 mark, what's the specific protocol, the sort of dose that seems to emerge from these successful studies, and why that length of time?
Okay, so the specific recommendation that you see derived from successful case series, especially when used proactively for high-risk patients, is typically twice-weekly sessions for the first 13 weeks of pregnancy.
Twice a week for 13 weeks. Why exactly 13 weeks? Why not stop at 12 or keep going?
It seems quite strategic. That 13-week duration is designed to basically bridge that entire high-risk gap we talked about. There's a major biological handover happening around then.
The placenta taking over.
Exactly. Before about week 12 or 13, the pregnancy is heavily reliant on progesterone produced by the corpus luteum in the ovary, and that's often where hormonal instability can be an issue. But by week 13, the placenta is generally well established, structurally and functionally, and it takes over as the primary source of hormones needed to maintain the pregnancy. Once that milestone is hit, the foundation is usually much more stable, and the overall risk drops sharply.
Okay. So the intensive twice-weekly support is kind of like temporary scaffolding, providing support until the body's own robust system, the placenta, is fully online.
That's a perfect way to put it. It's targeted support for a very specific period of vulnerability.
And didn't we also see some data suggesting this kind of treatment is actually feasible and helps manage the distress even for patients actively experiencing symptoms, like in threatened miscarriage?
Yes, we did. It's important to distinguish the protocol slightly here, though, that twice weekly for 13 weeks is often used proactively before problems arise.
Okay.
But there was that separate, smaller, randomized controlled trial, an RCT, that focused specifically on patients already diagnosed with threatened miscarriage. So they had active bleeding, cramping. The protocol they tested there was slightly different. Twice in the first week, and then weekly up to 12 weeks.
And what did they find?
Well, interestingly, in that specific small study, the difference in the ultimate miscarriage rate between the groups wasn't statistically significant. It could be the small sample size.
Oh.
But the key takeaway, and maybe the more relevant one for those patients, was the significant reduction in symptoms. Patients in the acupuncture group reported much less bleeding, less cramping, less pain, and they noted the treatment felt safe and was feasible to do even during that acute crisis.
Just alleviating that physical misery and fear during such a terrifying time, that's a huge benefit in itself, regardless of the final stats in that one study.
Absolutely. It speaks to the supportive aspect beyond just the biological outcome.
But let's nail down the safety picture overall. This is critical. For anyone listening and considering this, what do the big systematic reviews, the ones looking across many studies, say about safety? Is there any risk introduced by acupuncture here?
This is probably the most crucial and reassuring finding. The consensus from multiple large systematic reviews is overwhelmingly positive on safety.
Okay.
Across all the various trials they examined, including those with control groups getting no treatment or sham treatment, acupuncture showed absolutely no increased risk of miscarriage compared to the general rates observed.
No increased risk at all.
None indicated by the bulk of the evidence.
Yeah.
It's consistently found to be a safe, generally well-tolerated, non-drug supportive approach to use during the first trimester.
That assurance is absolutely essential, isn't it? Okay, so to wrap this up and bring it all together for you listening, we've established that the really critical window for support is before week 12. That's where about 90% of early losses occur. The proposed way acupuncture might help focuses on 3 key interconnected areas: boosting that crucial blood flow to the uterus and developing structures, helping to stabilize hormone regulation, and reducing the negative impact of stress.
Exactly. And the strongest research we have seems to focus on those high-risk patients, people with a history of recurrent loss or implantation failure. For them, the evidence points towards considering a specific, fairly intensive protocol.
That twice-weekly support for 13 weeks.
Yes, providing that physiological bridge, that scaffolding, until the placenta is fully established and takes over, significantly lowering the background risk.
This deep dive really does highlight a fascinating potential convergence, doesn't it, between sort of traditional insights and modern physiological understanding?
It really does. And, if I were to leave you with one final thought to consider, connecting this to the bigger picture, what really stands out is this idea that maybe the fundamental benefit of acupuncture here stems from enhancing uterine receptivity in that crucial regional blood flow.
Improving the environment, essentially.
Precisely.
Yeah.
Physically making the uterus a better, more supportive incubator. That core idea that local hemodynamics, just good blood flow, are absolutely key to implantation success. It really bridges ancient practices with our very latest understanding of reproductive science. And it makes you wonder, perhaps, whether actively maximizing uterine blood flow in that first trimester should be considered a standard supportive goal for all high-risk pregnancies, regardless of the specific tools used to achieve it.
That's a powerful idea to mull over. A fascinating convergence indeed. Thank you so much for guiding us through this really essential material today.
My pleasure.
We really hope this knowledge empowers you in your own health journey and discussions. Use this information well, and we'll catch you on the next deep dive.